So, eczema. You know, eczema is something I love to treat. And eczema is complex. Many people have mild eczema, including all my kids, and I did when I was a kid. And it's tough to treat because you have times when you flare and time when you're better. And especially when you're young, you can have eczema pretty significant. And as a parent, I feel like those are some of the most worried times when your child is just scratching everywhere and super itchy. So if I were just doing the basics of eczema, how do I approach it and treat it? I usually talk about moisturizing first. Most people are moisturizing appropriately, but often they're not. After a shower, you gotta put on moisturizer, and I like the stronger ones. There's a gazillion great, strong eczema lotions and creams. The less potent ones just won't last, and they disappear immediately. Ointments are amazing, like Aquaphor Vaseline, but they are really sticky. So people don't like the elegance of them, and they won't use them. So, you know, a few of them that I use are Curel Ultra Healing is awesome. Vaseline Intensive Care Lotion. Aveeno makes amazing ones. I also have Lubriderm, more for male skin, but it's a great one too. And a ton of other ones. In fact, if it specifically says for eczema, it's probably a good one. And I would use those. Creams. Creams are even better than lotions, but they're thicker and people don't like thick things on them. So I tell them you gotta do it within 3 minutes or 2 minutes before the mist leaves the mirror in your bathroom. And I'm really just trying to say when you're still humid and you've soaked all that in your skin, trap it in with a moisturizer. Everybody can do that, and that will help eczema probably 50%. Not in everybody, not in the super severe one, but in many people. Number 2, my next favorite treatment, you have to come in and see a dermatologist, but I actually give patients a mixture of healing eczema cream and a steroid. So steroids are great, they decrease inflammation and redness. You know, there is mild risk with them. Really, most of them are pretty safe in the ways that we're using it. And you should use it when you're flared. You don't use it forever, but you should use it when you're bad. But steroid just used will stop the eczema, and then they stop it and it comes back. Or they're told don't use it longer than 2 weeks because it can thin the skin, which it can if you use it in the groin daily for 6 months. But most other places on the body, used appropriately, it doesn't do that. But combined with the cream, they're almost, I think they're synergistic. And I got this idea from Dr. Sir Weiss, who is incredible and an eczema guru, and I've had so much success. You know, I have to thank him for that. So what I have him do, I have him mix it together, but you have to get the prescription steroid. Hydrocortisone will help, and if someone's in a bind, I'm like, just get a bunch of hydrocortisone ointment and use it. That's the over-the-counter one, and it will buy you some time. But if we can get you the little stronger stuff, which is still not as strong, it's diluted because you're mixing it with a cream, you know, which increases safety and decreases any side effects if there was some. But those are my 2 favorite starters. If I were to go to number 3, if we need it, if it's real bad eczema, or if it's, you know, you're getting scabs on it, or it's rarely weepy, but if it is ever weepy, and I want to treat the staph. So how do you treat staph? Certainly you can take oral antibiotics, but I have a super simple way at home. Go in the swimming pool. Your swimming pool has chlorine that will kill the staph, and it hydrates your skin, and then put the lotion on afterwards, and you'll do so much better. So a swimming pool bath, or if people are like, I don't have a swimming pool, you know, or it's winter, you know, then they make a swimming pool bath at home. And how do they make it? They mix a half a cup of, or a quarter cup of bleach, a quarter to half a cup of bleach with a half a tub of water. And I'm serious, most people when I say that, you know, I start with the swimming pool, but they're like, they basically envision you taking the Clorox tub and dumping it on their little kid. That's what they think that I'm saying. You don't want me to put bleach, and certainly that's not what I want. I want you to dilute it. It's going to be less strong than a swimming pool, and it's going to work amazing, especially if you put moisturizer on afterwards. You're going to kill the staph, which is a massive driver of eczema. It gets into your open skin, and because of your genetics, which makes you predisposed to eczema, you overreact. and form rashes, and then the skin barrier gets even worse, and staph gets in, and it's this bad cycle. So those are my top 3 for treating eczema. Certainly there's other things, you know, talking about taking oral antihistamines, which you have to take higher levels for it to help anything with itch, and a few other things that I like to do with eczema, but those are my favorite.